this is a 2-minute warning. Please press 1 to ask a question.
Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 102,861 lab-confirmed cases, 1,815 new cases reported today, 1,179 people in the hospital, and sadly, 1,668 people who've died. Since our last update, we've passed the 100,000 mark of confirmed cases. This is a somber, serious benchmark. We pray for those who've lost loved ones to this virus. As we continue fighting COVID-19 on many fronts, I'm glad to announce today that North Carolina is delivering over 900,000 masks and other supplies to farm workers across our state. Agriculture is vital to our economy and our food supply, and it's a tough job that you can't do from home. This personal protective equipment will be delivered this week to the North Carolina Cooperative Extension Centers across the state and then be distributed to our farmers. The 31 counties that are home to 3/4 of our state's farm workers will receive the first delivery. This effort is a partnership among our Department of Health and Human Services, the NC Cooperative Extension, the State Department of Agriculture, the State Department of Labor, and the NC Agro-Medicine Institute. We must keep food in our grocery stores and on our tables. To do that, we must help protect the farmers and their families from this virus. I appreciate the collaboration that made this delivery of equipment possible. And speaking of protecting people from this virus, I want to take a moment to thank major retailers like Walmart, Costco, Fresh Market, and Lowe's, and so many other businesses, small and large, which are requiring face masks in their stores. This type of leadership, by example, shows the public that these retailers truly care about their customers and their employees. For those who continue to defy basic decency and common sense because they refuse to wear a mask, either wear one or don't go in the store. The refusal to wear a mask is selfish. It infringes on the life and liberty of everyone else in the store. Not only is wearing a mask the decent, neighborly thing to do, it's the best way to boost our economy. Meanwhile, North Carolina continues to focus on ways to make testing more accessible and more available to communities that need it. Our Department of Health and Human Services has expanded free COVID-19 testing to underserved communities that currently have limited testing sites. All of these efforts help move us closer to success. Now, as July draws to a close, many North Carolinians who are out of work are worried about the upcoming reduction in their unemployment benefits. The federal Pandemic Unemployment Compensation Program offers people an additional $600 a week to unemployed workers who've been out of work through no fault of their own. This program has been a lifeline for families and their communities, giving people the ability to pay their rent or utilities, to put food on the table, and to make ends meet. I am urging Congress to act quickly to extend this benefit. Though we right now are adding jobs back into our economy, and that's good, folks are still struggling, and many are still out of work. So far here in North Carolina, we have paid over 815,000 people more than $6.2 billion. And it'll hurt these people and our economy if their benefits are drastically reduced. We've seen the dire consequences of reopening too early in places around the country. Their hospitals and ICU beds are full, and the virus is worse than it was in March and April. Many people cannot safely go back to work. They can't go back to their jobs, and many don't have jobs to return to. And while this virus continues to spread, we have to support these workers and their families. This extra $600 has been especially important here in North Carolina, where the legislature several years ago slashed unemployment insurance benefits to among the lowest in the nation and made them available for only 12 weeks. While legislators were in session the last few months, they refused to do anything to help. When the legislature returns, I urge them to reevaluate North Carolina's own unemployment compensation to support people who find themselves sidelined because of this virus. Now remember, this federal funding has a multiple effect. It has a multiplier effect, really, going from families' pockets back into our local communities, helping small businesses and our economy stay afloat. This federal assistance will expire at the end of the week. The clock is ticking, and all eyes are on Washington right now. I encourage people to make their voices heard on this issue. With me today is our Secretary of Health and Human Services, Dr. Mandy Cohen, our Emergency Management Director, Mike Sprayberry, and Secretary of Public Safety, Eric Hooks. Karen Magoon and Monica McGee are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. I will recognize Dr. Cohen at this point. Dr. Cohen?
Thank you, Governor. As the Governor just shared, we've passed 100,000 cases in the state, and over the weekend, we again set record for highest number of new cases reported in one day. Our percent of tests coming back positive has remained stable, though still higher than we would like, and we continue to see small increases in hospitalizations across our state. Here in North Carolina, this pandemic remains at a simmer, not a boil. We can and must avoid becoming the next Arizona or the next Florida. Flattening the curve and keeping it flat requires daily, ongoing actions. There's no one and done here. We've shown throughout this ordeal that North Carolinians are strong and that we will work together to do what is needed to protect one another. Throughout our department's response to the pandemic, we've been doing our best to provide timely and transparent information. One tool we use to do that, in addition to these briefings, is our online COVID-19 dashboard. It gives an interactive overview of the key metrics we're monitoring to inform our pandemic response and some key decision making. This past weekend, we were able to add new data to that dashboard related to hospital capacity. You can now find information on hospitalizations by region, inpatient and ICU bed usage over time, and a breakdown of hospitalizations by suspected and confirmed COVID-19 cases. Moving on to testing, yesterday, Governor Cooper announced our selection of a third vendor to expand free community testing to historically marginalized communities. The North Carolina Community Health Center is that new partner. They join our two existing vendors, Vidant and Origins, who have already coordinated more than 70 community testing events providing free COVID-19 testing in African American, Latinx, Hispanic, and American Indian communities. Information about additional upcoming community testing events can be found on our website, covid19.ncdhs.gov. We know more work is needed to get faster turnaround times for tests. As I've shared previously, our commercial labs are swamped with samples from around the country, and our hospital labs are still struggling with supplies. We're attacking this problem in a number of ways, including pairing testing sites with labs that do have more throughput capacity, buying reserve lab capacity on behalf of the state, and working to diversify our testing modalities, including exploring the use of more antigen testing and other techniques. Now, this is not an issue unique to North Carolina. Again, we need federal leadership here to make fast and faster improvements. I also want to highlight some new CDC guidance about testing that should also help alleviate some of the testing backlog. The CDC is now recommending a symptom-based instead of a test-based approach to people to determine whether they no longer need to be considered infectious and can end isolation. Data is now showing that people with mild to moderate COVID-19 really only remain infectious no longer than 10 days after symptom onset. So now someone who has had symptoms and tested positive for COVID-19 can stop isolating when they can answer yes to the following three questions. First, has it been at least 10 days since your symptoms started? 2, has it been 24 hours since you last had a fever without using fever-reducing medicines? And 3, have your symptoms such as cough or shortness of breath improved? We at the state are updating our guidance to align with this new CDC guidance, and this should make it easier for North Carolinian businesses and employees to get back to work. Until now, we know that many businesses were requiring a negative test result in order to return to work. This new CDC guidance said that is not necessary. It is my hope that this broad awareness and understanding of this new CDC guidance and these changes will help alleviate some of our pressure on that testing infrastructure and help improve turnaround times. And again, there's another even more impactful way we can reduce pressure on our testing infrastructure. It's by slowing the spread of this virus. And again, there are 3 simple steps that everyone in North Carolina can take to reduce viral transmission and ultimately get North Carolina back to work, back to school, support our local businesses, and reignite the economy. You know what it is. It's those 3 W's. Wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. Wear, wait, and wash. Thank you, Governor.
Thank you, Dr. Cohen. Now we'll hear from Mike Sprayberry, our Director of Emergency Management. Mike?
Thank you, Governor, and thank you for your leadership. Good afternoon. Today is day 134 of the State Emergency Operations Center's COVID-19 response. As the Governor discussed, our work to supply PPE to our state's farm workers is well underway. That has been a priority project for us, and we are 98% complete on these shipments to agricultural extension offices. In addition to supporting essential workers in the food sector of our economy, we are also pushing out cloth face coverings for school students. That project is approximately 60% complete, with deliveries made to 213 of 336 schools and school districts. We're also developing plans to push PPE to meat processing plants and to local boards of election in all 100 counties in order to support poll workers and voters in this fall's elections. Our supplies of PPE remain good. The supply chain for face coverings, gloves, gowns, and other protective gear continues to improve. We have more than a 90-day supply of most of our key items of PPE, and I'd like to give a special thanks to Assistant Secretary Cooper over at DHHS and her team for that. The State Emergency Response Team is currently consolidating all PPE supplies into one central warehouse under the outstanding guidance of our CERT teammates at the Office of Emergency Medical Services. But we're also still filling daily requests for personal protective equipment. So far, the state has spent more than $168 million for PPE purchases for the COVID-19 pandemic. I want to take some time today to thank our North Carolina National Guard partners as they wind down a major portion of their activation mission in support of the COVID-19 response. For more than 130 days, National Guard personnel have supported food banks with warehousing and distribution, and they've delivered meals to support school nutrition programs and many other things. They've helped receive, unload, ship, and deliver PPE from our warehouses, and they've helped to ensure our state IT infrastructure remains secure during an elevated time of cyber intrusions. And most recently, they have supported community testing sites and testing in our state correctional facilities as we test all of our offenders. For the past few weeks, the Guard has been working to make sure the partners they are supporting are well positioned to carry on the COVID-19 response after they're gone. At the end of this week, almost all of those men and women from both the Army and Air National Guard will end their activation and return to their civilian jobs. We thank them and their families and their employers for sharing them with us. To the National Guard team, you have provided vital services to the state. Here's a hearty hand salute for a mission well done. Many counties have been using the non-congregate sheltering program to help slow the spread of the virus by sheltering individuals in hotels who are vulnerable and with no other safe place to quarantine, isolate, or social distance. While the federal government ultimately covers the cost of providing those hotel rooms and the associated services, local governments must first pay those costs and then seek reimbursement through FEMA's Public Assistance Program. For many local governments, this is a significant financial challenge at a time when local revenues are lagging due to the pandemic. Last week, a proposal by the CERT for a state-centric plan for non-congregate sheltering during the COVID-19 pandemic was approved. Making the shift to a state-centric program will allow North Carolina Emergency Management to cover costs and then obtain the federal reimbursement, relieving local governments of that fiscal and administrative burden. We're working to implement this program quickly, so stay tuned for further guidance in the coming days. Lastly, like you just heard Madam Secretary, remember to observe the 3 W's. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. This is how we slow the spread of the virus. Working collectively together, we have the power. And as always, don't forget to look out for your family, friends, and neighbors. Call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, Governor.
Thank you, Mike, and thank you for your leadership. We'll now take some questions, and if you can identify yourself and the organization that you represent, we would appreciate that. We'll have our first question.
Our first question is from Michael Highland with CBS 17.
Hi, Governor. This is Michael Highland from CBS 17. I wanted to ask you, as we're seeing more school districts choose to start the year with remote learning, are you considering any changes to the Plan B option that may make that somewhat more workable for school districts? You've said it's a goal of yours to have students back for in-person learning. Thank you.
We want to make sure that the local school boards and superintendents have the option, if going all remote, if they believe that is in the best interest and the health and safety of their students. We believe that in-person instruction can be important, and that other school districts are looking at continuing to go forward with Plan B. They also have a remote option for families. So we believe that we're in good shape where we are. We want those local school districts to make the best decisions that they can for those children, and we're here to continue to help provide guidance to them as they go through this. This is a difficult time for parents and students. It's a tough time for teachers and staff as they're struggling the best way to do this. There's no easy answer to all of this, but I do think we have a good plan in place with both Plan B and Plan C that school districts can choose from. Thanks.
Our next question is a follow-up from Michael Hyland, CBS 17.
Hi, I had a follow-up on an unrelated topic. Based on any conversations and plans you've seen from the State Board of Law Examiners, do you feel comfortable with them holding the bar exam in person in Raleigh next week?
You're always concerned about people's safety, particularly when they're indoors. And I would encourage the State Bar of Law Examiners to make sure that they make accommodations for people and they keep people as safe as possible. Yes, I'm concerned about it. However, this is a decision by the State Board of Law Examiners. They have the statutory authority here to make that decision. Next question, please.
Our next question is from Sam Walker with Outer Banks Today.
There.
Virginia Governor Ralph Northam said last week he's worried about the spike in cases in the Norfolk area, which could move into the northeast corner of the state through residents that have to work and shop in Hampton Roads. Have you had direct conversations with Governor Northam about this and how concerning it is that since some northeastern North Carolina counties have some of North Carolina's lowest case counts, and this could cause a spike here?
We know that the virus does not respect state boundaries. So yes, we're always concerned when there is a spike in virus in the states that surround us. We're definitely looking at that in South Carolina and Georgia and Tennessee to a certain extent. I've not talked directly with Governor Northam lately. We have conferred on the coronavirus, and we're often on conference calls among governors and with the federal coronavirus task force. I think it's important that we continue our efforts to slow the spread of the virus, both in North Carolina and Virginia. I think unlike South Carolina, you have in Virginia a mask mandate, and they've taken steps to try to slow the spread of the virus. We just ask people to continue to be smart about what they do, practice the 3 W's, and we'll continue to work with other governors to work together to make sure we slow the spread of this virus. Next question.
Our next question is a follow-up. Sam Walker, Outer Banks Today.
Secretary Cohen, with many in northeastern North Carolina seeking their health care in southeastern Virginia, are you able to incorporate that into North Carolina's data on hospitalizations in any way? And how is that impacting how the state's looking at things in the Northeast?
Thanks for the question. So our hospitalization data is really strictly based on what is happening here within the state of North Carolina, but we definitely are keeping our eye on places where we know there is a lot of cross-border crossing in order to get their care. Actually, the place that we are watching most closely is in the Charlotte area, and we have had reports of increased amount of folks coming from South Carolina into North Carolina to get treatment at some of the hospitals in the Charlotte area, as well as get testing. So we'll continue to keep our eye on that, as well as the northeast part of our state as well. Thank you.
Next question, please.
Our next question is from Nate Morabito with WCNC.
Hey there, Governor. Even before this pandemic, the federal government ranked North Carolina last in the country for timely unemployment benefits. We know the state has hired 2,000 more employees, changed leadership, and offered new training, but we continue to hear from the unemployed who are growing more and more frustrated. Some who are able to get through and get hung up on. Multiple agents are telling them different things. and these people are waiting extended periods of time for the money they so desperately need. When will the state fix these problems?
First, there's been significant progress made in this area. As you know, a system that was used to 12,000 claims a month was overwhelmed with over 1 million claims in a short period of time. However, it is critically important to get these payments to these families who are living on the edge. And one of the reasons why I'm urging Congress to extend this federal benefit, which will make a world of difference to these people, because in North Carolina we rank near the bottom of the amount of money that we pay to people who are unemployed, as well as a very short period of time that those payments last. That being said, there's been over $6.2 billion paid to over 815,000 people. There have been about 251,000 people who have been denied claims because they did not qualify for it. And there are several thousand people, about I think 4% at the state level and 6% at the federal level, where their claims are more complicated. Those claims may be contested, and the department is working hard to get those claims resolved. They've increased the number of people on the phones. They put in a chat function, so they're having more and more communication with these people to try to answer to their questions, and continue going to work every single day to try to make sure these benefits are available to people. In addition, we're pulling people from other agencies to DES in order to be able to help them and assist them with this significant but highly important task. And they're going to keep working every day, and I'm going to keep pushing them. Thanks. Next question.
Our next question is from Gary Robertson with the Associated Press.
Yes, hi, it's Gary Robertson with AP. I wonder if Dr. Cohen could talk about emergency rooms. We've heard a lot of discussion about hospital capacity and bed capacity, and clearly when the number of people with COVID-like symptoms are entering the emergency rooms, it would lead one to believe that perhaps emergency rooms themselves are being stressed by the number of patients they receive. Can you give us any insight as to whether emergency rooms are seeing more pressure in terms of capacity compared to hospitals? Are they the same? Has there been anything that you could tell us anecdotally about what's happening there? Thank you.
Sure. Thanks, Gary, for that. And as you know, part of our surveillance data that we report on our dashboard every day is about emergency room visits and what percentage of those are we seeing that are COVID-like illness visits. Again, this is before even a test result comes back, so you can go and make sure that you are tracking along with us on that surveillance data. And what we can say is that in certain parts of the state, we are seeing more folks come to the emergency room. We still are tracking our hospitalizations. You can now see that by region. You can see ICU usage. Like I say, we are increasing slightly on our hospitalizations, and we're continuing to watch that closely. But both from an emergency room capacity as well as a overall hospital capacity, we still have the ability to take on additional patients, whether they're COVID patients or someone who's having a heart attack or in a car accident. So that is good news. And I think that takes hard work from all of us to continue to keep that virus level low. What we're seeing in other states, whether it's Texas or Arizona or Florida, is that they are running out of hospital capacity. Their emergency rooms are getting strained. We don't want to be in that situation. And I think that is why you continue to hear us say that we have to do the 3 Ws. We need folks to take leadership on face coverings. It is working, right? We are not seeing what other states are in terms of boiling over, but we have hospital capacity. We do have emergency room capacity, but we need to do hard work every day to keep it that way. And that's what I think we're going to keep our eye on as we continue to go through this summer. Thank you.
Next question, please.
Our next question is from Eric Spanberg with the Charlotte Business Journal.
Hi, Governor. This is Eric Spanberg from the Business Journal in Charlotte. I'm curious, since you know Charlotte and Mecklenburg County have been, trouble spots throughout this, typically with the most cases. There is a movement to set a curfew for alcohol sales that's going to happen soon. Are there any other restrictions or limitations on business or movement that you would like to see to try and quell some of the spread in the Charlotte-Mecklenburg area?
We're continuing to monitor the trends and the data. We have not made any particular steps to go backward yet, and we do not want to do that. We encourage local governments, if they are seeing particular problems and hotspots, to make decisions that they think would be in the best interest of slowing the spread of the virus and protecting their communities. And I know that our Department of Health and Human Services and Public Health is working with their local public health officials on these kinds of decisions. Those decisions can be a good one because we know, my dad used to tell me nothing good ever happens after 11. Well, people do when they are in bars and they are together or in restaurants and are together, then they could potentially increase the spread of the virus. And this is a kind of tool that can be used in order to slow that down. Would you have anything to add to that, Dr. Cohen? Okay, thanks. Next question.
Our next question is from Lynn Bonner with the News and Observer.
Thank you. Lynn Bonner from the News and Observer. Dr. Cohen, I'm wondering at what point do you become worried or alarmed about hospitalizations? You say that the number is concerning, but when does it become more of a problem? Is it when 1,500 people are hospitalized or 2,000? And at what point are hospitalization regions in an ICU danger zone? For example, it was reported recently that the Duke region has 14 empty staffed ICU beds and Metro Atlanta has 38 empty staffed ICU beds. Is that too few?
Thanks, Lynn, for that question. I think there are a number of factors we look at. First, you want to make sure that we are looking at hospitalizations both statewide as well as regionally. And you want to look at the number of beds that are available as well as the beds that folks could staff up to. Hospitals often do move around their personnel, their doctors, their nurses, to make sure that they are going to where the patients are and staffing to appropriate needs. So we have capacity in our system. The things that we are looking for is both, are we increasing, but also the pace of acceleration. How quickly are those hospital beds filling up? How quickly are folks needing to be in the ICU? What we have seen, and you can see from our dashboard now that we have more granular information there, is actually our usage of ICU beds has been pretty stable. We've been around 300 people who have been using ICUs, a little below, a little above, for a number of weeks. And so the stability there is a good sign. And so we continue to watch that, of course, and if there are any things that we see some trends going in the wrong direction, we will get on the phone directly with those systems to make sure we understand that data. Again, ICU usage can be because of COVID, but it could be because of other things, unfortunately, heart attack, stroke, other things. So we often are in touch, making sure folks are able to articulate to us, what's going on in their hospitals. Do they need help? Can we assist in any patient movement? We haven't needed to enact any of our surge plans at this point, which is a good thing, but we'll continue to keep our eye on it. And again, I think it is both, is it increasing, but also the pace of acceleration that we are looking for as well. Thanks.
Thank you. Next question, please.
Follow-up, Lynn Bonner, News and Observer.
Thank you. Dr. Cohen, I was looking at the 7-day rolling average of new cases, and it seems to have been leveling off. Can you provide some insights on why this is happening? I mean, has the state gotten past peaks that were related to holiday gatherings, or are all of the peaks for nursing home and prison cases, is that all past? Or is it too soon to look at trend lines because test results are being delayed? What's behind the leveling off?
So, Lynn, thanks for that question. I would not call us leveling off yet, and the reason for that is Saturday was our highest day of new cases that we reported in a single day. And so we are still eking up, but I think you are right in saying we are not accelerating at the pace we are seeing some of the states around us accelerate, and that is a good thing. So I don't know yet if a couple days of what we're seeing is a trend, or is that, to your point that you made in the question, is that some lag in test results coming back? I think it's too early to tell. What I would want to encourage folks to say is, look, we still know we have a high number of new cases coming back every single day. We know what actions we need to take to slow the spread of that virus. We don't want to boil over as a state. And so we're seeing these early warning signs. The more we can do right now to keep that virus level low, maybe we will be starting to see that stabilization. That would be terrific. We would love to see that stabilize. I think we're not quite there yet, but we'll continue to watch our trends. And again, unfortunately, with the highest day of new cases last Saturday, I think we need a little bit more time to understand exactly where we are, which is why, again, we always talk about what is that those trends look like over a 14-day period. Thanks.
Thank you. Next question, please.
Our next question is from Michael Perchik with ABC 11.
Good afternoon. It's been a few weeks since the statewide mask mandate has been in effect. However, we haven't necessarily seen any sort of market drop or change in the case numbers or hospitalizations. At what point would you anticipate us to see results from the mask mandate? Or do you feel that the results have been reflected, that we haven't seen any sort of massive spike, especially now that we are about 2.5 weeks out from the July 4th weekend?
I certainly believe that the mask mandate is contributing to the fact that we are not spiking like some other states. We want it to have an effect at some point to slow the spread of the virus and have these numbers start a downward trend. And we believe that it will contribute to that. There has been increased compliance with wearing face coverings across the state. We're getting that anecdotally. We're hearing from retailers, and I think people are becoming more and more aware of this and how important it is. I made some pretty strong comments earlier today about people who are being selfish and refusing to wear a face covering. What you're doing when you wear it is protecting other people around you. You're protecting your family. You're protecting strangers. So we're going to continue to encourage this, and we hope that we see even more positive results from the figures that we're seeing. Dr. Cohen, would you want to add to that? Okay, next question, please.
Our next question is from Matthew Herchick with WITN.
Governor Cooper, Matthew Herchick with WITN. Can you talk about testing times right now? Obviously, with the new CDC 10-day guideline and some testing and laboratories taking 7 to 10 days to get testing results back, what can the state do at this point to maybe increase that lag time?
We're continuing to establish more places for testing and collecting more samples and getting it done on the front end. One of the problems that we've been seeing, though, the last few weeks is the lack of supply chain with testing supplies and reagents that these labs need in order to turn around the test results in a period of time. And when you go 2, 3, 4, 5, even 6 days waiting for a test, that person is supposed to isolate and not be around people and not go to work, and that's hard for somebody dealing with that. In addition, our contact tracers want to be finding out if this person is positive, who they've been in contact with. So it reduces the effectiveness of a lot of things we're doing when we have a slow turnaround time. We've continued to push the federal government on this issue. I think a lot of this has to do with the lack of a coordinated federal strategy who could get a hold of this supply chain and continue to push it in the right direction. Meanwhile, we're going to do everything we can to find ways to get more testing to people, to work on our contact tracing, and to help try to find these supplies and reagents in order to be able to speed up the turnaround time. Dr. Cohen, would you want to say something?
Sure. Just to reiterate what I shared earlier, there's a number of ways in which we're trying to attack this problem. There's no one solution. One, we are trying to pair up the testing collection sites with labs that do have more capacity. We know some of our bigger commercial labs are really swamped, but there are smaller labs that do have capacity, and we need to make those matches happen. Second, we are actually, as a state, buying lab reserve capacity. You will see in some of our RFQ processes that we have actually gone to procure lab capacity to be able to make sure that we can try to improve some of our lab turnaround time. I think the third thing that we're doing is needing to explore other modalities of testing. This, again, is where more federal leadership is needed. We want to explore using other types of testing like antigen testing. This is different than antibody testing, but antigen testing detects the virus. And again, another modality that we can use to try to diversify the kinds of ways in which we are doing lab testing, as well as other mechanisms. We have a lab test surge work group with a lot of lab leaders who have come together to really help us think through what other ways can we get at this turnaround time problem. There's no one easy solution. We're going to work on it here, obviously, in North Carolina, but this is, as the governor said, is where really federal leadership and an overall coordination of a federal strategy is really needed. Thank you.
Thank you. Next question, please.
Our final question today will be from Sharon Van Zwyten with Spectrum News.
Hello, Governor. This is Sharon Van Zwyten from Spectrum News. We'd like to know what kind of investments is the state making in high-speed diagnostic lab equipment for hospitals and medical offices?
I'll let you take that one.
Hi, thanks so much for that question. So we are certainly making investments for the state public health lab and bringing on new diagnostic platforms in order to get some additional throughput at our own state labs. Number of our commercial lab partners are also doing the same thing and trying to bring on additional capacity. Again, we continue to be limited by some of the reagents. So even if you bring on some of these expensive lab platforms, you still need the reagents to run those platforms. So I know that there are a number of hospitals who are trying to make changes, but they've committed to some of these larger platforms. They've invested the money and the resources in bringing these platforms online. Now they need the supplies to actually make them run. So again, we're trying to look at multiple different ways in which we can try to improve testing turnaround time, and we'll continue to work closely with our partners and see how the state can continue to support all of those efforts. Thanks.
There's a follow-up, ma'am.
Oh.
You can ask.
Is there a follow-up to that?
We have a follow-up from Sharon Van Zwyten, Spectrum News.
Thank you. We'd like to know what specific federal assistance you've requested or intend to request.
Sure. I assume you're still referring to testing and testing turnaround time. So there's a number of things, I think, from the federal side that folks have been talking about. Some of that is just transparency. How are supplies being moved around the country, and how do we make sure that North Carolina is getting the supplies they need, particularly to some of our hot spots like our hospitals in the Charlotte area. So I think that's one. Second is how can we use the Defense Production Act or other mechanisms from the federal level to think about those supply chain issues. And third is regulatory. How do we use the regulatory arms of the federal government to speed up some of the innovation and different ways to implement diagnostic tests? I think the step the CDC took today or over the weekend in terms of new guidance to say you don't need a repeat lab test to go back to work, I think that was helpful and good. Are there other ways in which we can, the FDA or others can use their regulatory power to help us do different diagnostic methods, give us the guidance to know which populations should we use for different technologies? Those are the kinds of conversations that I know are ongoing and that we'd like to see more happen at the federal level. We will be doing that here at the state level, but we are not alone in this. Every state is sort of going through this at the same time, so really having that coordination at the federal level is important. Thank you.
Thank all of you for joining us today. Remember the 3 W's and stay safe out there. Thank you.